students. This week we will be talking about healthcare and the healthcare crisis in the United States. Note that as we begin this, and it will be reviewed several times during the presentation, that the U.S. is the only post-industrial nation that appears to have a large reaching healthcare crisis. There are cost issues with other post-industrial nations, but not at the rate that we see in the U.S. Okay, so before the 1900s, becoming a doctor was not something that your family necessarily wanted you to do. It was almost a guarantee of poverty. Doctors were not compensated well. A lot of it was barter. It wasn't until 1900 that the AMA itself was formed, and there really wasn't a lot of knowledge about what we know today. So the modern age of medicine didn't really begin until the late 1800s or early 1900s. Prior to that, they would bloodlet or put leeches on people thinking their blood was bad, maybe spirits, and they would perform rituals because they thought, and a lot of people think that this is the reason why exorcisms were started to be performed. They thought it was demons that were causing someone being ill. Now, when you get into the 1900s, 1920s, we had a rise in some plant-based medicine relief that was gained from the poppies, from the cocoa plant. So you have heroin and morphine. This allowed people, doctors, to perform surgeries that they hadn't been able to perform without a large number of their patients dying from shock. There was no anesthetizing of any kind. Cocaine numbed the area as well. Cocaine, all these were sold through Sears catalogs. And of course, we all know Coke, the drink, Coca-Cola, had cocaine in it originally. It was seen as a miracle drug. And at this time, we see some employers, mainly and predominantly railroads, began to offer at least injuries on the job. So if someone was sick or got injured on the job, then they would offer them some form of medical care with their employment. You begin to see a rise in diseases of poverty and poor urban planning. So this is predominantly in cities and diseases that we are unheard of in modern US, like cholera, dysentery. Malaria was in the US and southern states prior to our discovery of chemicals that killed the mosquitoes that also killed the bald eagles, but we won't go there right now. That'll be on the environment, right? So the 1930s and 40s, we see development of penicillin, the miracle drug. It allowed us to treat bacterial infections. People didn't die from these infections anymore. Surgeries were, again, if you didn't die from the fact you were in shock because there wasn't any type of way to anesthetize you, you died from the infection that was caused afterward. So both those things now have been tackled. Doctors oppose insurance for medicine. They impose private insurers. They didn't believe it was necessary. Social Security, though, in the New Deal also included universal health care. But the opposition by the doctors caused it to be labeled communist and also dropped from the New Deal. So we could have had universal health care this entire time if it wasn't for doctors. Ironically enough, the AMA is now the one pushing universal health care in the US. Ah, the irony. So hospitals and doctors, however, they're seeing that as we pull out of the depression, people aren't spending their hard-earned extra dollars on medical care. And because there's been this increase in the number of people attending medical school as we learn more, it becomes a science, they're out there floundering. Hospitals and are not filled all the way, and doctors don't have a patient load that can allow them to maintain their a style of living that they now are becoming accustomed to as being social status, like Weber had stated, where doctors are revered, as well as the income-driven push for becoming a doctor. And so they offer these rudimentary health insurance plans through their hospitals. So you would pay a fee up front or you'd pay a monthly fee, and then you were guaranteed that if you needed health care throughout the year, the hospital would take care of you, the doctor would take care of you. And this began at Harvard University. Now you see Blue Cross and Blue Shield, and then other insurers who previously thought that going into health insurance was going to be a monstrous cost to them and would not create any profits. But when they enter, all of a sudden costs increase to 4.5% of the GDP by mid-century. So from the 1970s through 1990s, we see different political shifts where the government began to get much more involved, actively involved in the healthcare systems in the United States. So this begins with Nixon, who had through after vast lobbying by a group called Kaiser Permanente, who is still in existence today. They created what's called a concept of HMOs, health maintenance organizations, and they were hoping to um, bring costs of healthcare down through preventative medicine. However, while they did offer free yearly physicals and some other preventative medications and other procedures, they also opened the door to profits, for profit health insurance. This was huge because before Nixon, health insurers were driven primarily by nonprofit. Now, nonprofit is very rudimentary in as much as profits, there are still ways to extract profit, whether it's reinvesting in the company or whether it's in larger salaries for leadership. And we see this happening today with modern CEOs. There's still a way to extract money out and distribute it somewhere besides where it should be distributed. But the end result is that now we begin the for-profit healthcare insurance. We also begin this push with HMOs. There still retains a large portion, like Blue Cross Blue Shield, that were the traditional old standard of health insurance. And the government at this time also believes that there's a doctor shortage in the United States. So they pushed for more people to enter medical school and graduate and become doctors. And this also occurred when Nixon happened to restructure how higher education was funded by the federal government. So what they used to do is the federal government and the state governments used to subsidize the universities directly. So it kept tuition costs dramatically down. What happened when he shifted the burden away from the government subsidizing the universities and instead subsidizing the students directly? And what this did is opened up this what we know to be the student loan crisis. Since the cost of tuition rose, obviously, if there's no more subsidizing from our tax dollars, and then the onus was put on the student to pay for that and then repay those right in their student loans. And but there were some good things happening. We eradicated smallpox. That was a global effort, and it worked. Yay, a big victory. And we had our eye on other bad diseases and childhood diseases that tended to cripple people or kill people. And obviously, unfortunately, that's kind of come to a standstill with the. We'll talk about that later in some other issues with healthcare. But healthcare costs continue to rise even with the HMOs being introduced, and it's now double the rate of normal inflation. So we begin to see the real growth in that. There also began a rise in complaints from the insured persons with health insurance. So this started in the 60s, but it really gained momentum going into the 1970s, 80s, and 90s, and through today, actually. Medical advances, gave extraordinary assurances for families to be able to be treated for even diseases that had been pretty routine, like high blood pressure, diabetes, and other heart conditions, etc. But it also raised the cost for families. And as policy costs increased and more lobbying done by health insurers and the AMA and hospitals, there was just this vying for who was going to get the dollar, and these costs had no limits. They had no caps. So enter into 1992's general election, and President Bill Clinton, once elected, said that he was going to implement universal health care and have the U.S. join the rest of the free world in offering that for its citizens, paid for through taxes. And the effect of money and lobbying money in Congress just really came through to watch how this was completely crushed. It never even made it to the stage where any bills were written at all. So universal health care once again was attached to the awful C word, communism, and it was shelved again for the time being. So at the same time all of this is going on, Congress has been continually borrowing from Social Security and Medicare. Medicare is the health program for seniors. So they never paid it back. To this day, they haven't paid it back, which is a lot of the reason why Social Security is in such dire straits. So President Clinton said, well, at least we can try to do this. And he knew that the Republican Party was the party of a balanced budget, was being the operative word, not today, currently. And so they worked together and wrote a balanced budget for the first time in modern history. And it actually had zero deficit, zero additions to the deficit. And doing that, it would also create a surplus. They wouldn't have to borrow from Social Security or Medicare, and it would remain solvent until the year 2030. But then we have our 2000 election, and President George W. Bush reallocates the surplus. He decides that it's better to give it as a tax rebate rather than let it sit around because it would stimulate the economy and people would, purchase more and, yada, yada, yada. And it actually did nothing. A lot of the money, most of the money, went to families who are making more than 70,000 a year, which today is comparable to families making $150,000 a year or more. So that was actually, really good money back in the day, and like $150,000 yearly today is. And then you see this growth in Big Pharma's lobbying efforts in Washington, which is placing a very large burden on employers who provide health insurance, and they deem this as an unsustainable um, continuation. There's no way that they can continue to provide good healthcare benefits to their employees at the continued rate of increases in costs. So we talked a lot about health insurance and healthcare crisis. Now we're going to talk about why is healthcare even important? So it doesn't matter what society it is. The end result is if your people are sick, they can't be productive. If they're hunters and gatherers, they can't go out and hunt, they can't go out and gather. If they're farmers, small farmers, they can't till the fields and take care of the crops. If they are mothers and fathers, they can't take care of the children. If they're children and they die, obviously you're, suppressing population growth, which is needed for continuation of any society. So those are very functional concepts. You can have a large number of the people in society who are ill, or it will be a dysfunction that will need to be remedied. And if you look at it from a conflict theory perspective, you look at diseases of poverty, increasing government expenditures on Medicaid and disability insurance through Social Security. And you also look at commodification of healthcare as a good. So because it has a dollar attached to it, a dollar amount attached to it, it now becomes a service or good that can be, that can marginalize people who don't have a lot of money. And then the government expenditures, as they increase for poor people on Medicaid, then they begin to cut those programs. So that's how conflict theory would see it. And then if you look at how our expectations and definitions of health and wellness, what role the sick role actually means, and the medicalization of illnesses like addiction, that was considered a choice. Now it's being considered an illness. And through these redefining expectations of what sick people are in society, we're able to hopefully and continuing to help people who have these different conditions that had been deemed choices and had not been deemed medical conditions. So where are we today? So the Affordable Care Act, the ACA, Obamacare, Romney Care, because that's what it's based off of. This did a lot to help. It had noble goals, and it was theoretically supposed to almost minimize the number of people who had no access to health care. And for some people it did. And again, in theory, and we'll get to this in a moment. So children were allowed to stay on their parents' plans until they attained the age of 26. Why is this an important concept? It really helped an enormous amount of middle class families because you have to remember that most of them send their kids to college, or even if they're going into trades or maybe trying to work their way up the company ladder, they often, these positions don't have any insurance, any health insurance. So they were initially bumped off at 18 years of age, some allowed up until 21 if the child was attending college. But 26 allows some time for that child to get their foot in the door at a company, to finish out college and gain employment that offers healthcare benefits. It also, like the HMOs did, mandated that there was your yearly physical was included in the cost of your premium. So when you paid your premium, it automatically assured you that once a year you could get basic tests done, and we'll go over that in a second. And it would allow you to somehow be preventative, to seek help before the health conditions arise, or ones that could potentially come out of your poor health or poor whatever, that they wouldn't become problematic and require more costly care. Also included was maternity and infant care. Believe it or not, that was not necessarily included in all health policies. So prenatal care, extremely important. Matter of fact, before the ACA went into effect, the U.S. had the highest rate of infant mortality than any other post-industrialized nation and some developing nations. A child in the U.S. was less likely to attain the age of 1 than a child in Nicaragua. And now that has come down. We've actually entered to the fact where we're in with all the other industrialized nations. That infant mortality rate has dropped significantly. Unfortunately, our maternal death rate is still very high. But story for another day and something we can work on. So birth control was also included in insurance policies. The church, Catholic Church especially, really fought this. But it's important so that women can choose not to have their children at a young age and wait until they're more established. And also when women's health care was mandatory. Again, mammograms weren't always covered. Pap smears weren't always covered. These things help prevent serious and deadly illnesses from occurring. Cancer, basically. So it's still an insurance-based system. So it still can be profit-driven, which is where we get into some of the issues. It was supposed to expand Medicaid in every single state. Unfortunately, there was a court action that occurred. One of the states or a couple of the states took it to court all the way up to SCOTUS, and they ruled that it was an overreach by the federal government to force states to implement Medicaid for expanding it beyond what it normally is, which is parents of minor children who are in poverty, and people underneath the age of 18. So unfortunately, Michigan, it does happen to be one of the states that expanded Medicaid. So that's a good thing. But there are some costs to that too, in that if you accept that, and you, at the very bottom in the fine print, that the state of Michigan can uh, put liens on your property or homes to reimburse the state for the costs of end of life care. So if you were to get cancer at the age of 30 and it was a cancer that you were gonna perish from, they could slap a lien on your house and sell the house out from underneath you after you died, out underneath your family, as long as there were no minor children in the home, and they apply that to reimburse the state for your care. So the issues that seem to come with this is that they've increased premiums, especially after President Trump eliminated the mandatory tax penalty. And the tax penalty was extremely unpopular. It was put there to force everyone to purchase some type of health insurance or apply for the expanded Medicaid in the states that have it. Unfortunately, the premiums were so high for some families that it was really put a burden on them. So a lot of people just went and took the tax penalty because the first couple of years it was relatively low. And I know my daughter, who was working at McDonald's at the time, actually paid the tax penalty the first year. And even though it was only $500, it hurt her during tax time. So compared to other post-industrial democracies, we are the only country that does not have some form of universal health care for all of their citizens. So looking at Canada's system, they have where the federal government, the Canadian government, doles out money to all the provinces, and the provinces are like large states, maybe like regions, but they're kind of looked at like large states. So they each get allocated a certain amount of money through the Canadian government, and then they execute and manage the system, adding in additional taxes that they may charge their citizens in that province. And they don't cover everything. Dental care is not covered. However, Canada's government has provided each province with some additional funding to set up free dental clinics for people who are at risk, who can't afford dental insurance. And by the way, dental insurance is one of the cheaper insurances. You can get a fairly decent policy for about $50 a month. May not cover big things like oral surgery and what do they call those? Oh, snap. Well, anyway, it doesn't crowns. There you go. It doesn't always cover some of the more expensive things, but for fillings and extractions and teeth cleaning, that's all covered. Now, the UK has the National Health Service, and the way that they're trying to reduce costs, increasing costs, is by providing incentives to the doctors for improved patient health. So they get a flat salary, and then they get bonuses if a majority of their patients quit smoking, or a majority of their patients begin to drop their blood pressure, if it was the ones who have the higher blood pressure, or if people lose weight, or if people get regular mental health evaluations, so that these problems don't get so large that they become a burden on the system. Also for the UK, they have a $10 across the board copay for all prescriptions. So if you get a prescription for ibuprofen, that's $10 copay. If you need HIV medication, it's also a $10 copay. So very expensive drugs get covered at the same rate. All drugs are covered at the same rate. France, their system is the closest to the US because they work in concert with private health insurers. So they do, like the ACA does, require all their citizens to obtain some form of health insurance. And the government negotiates the cost with the insurance providers, and they cap it at a fairly decent rate so that it doesn't burden families from having to pay high premiums. So, hospitals and doctors are private. I know that was a big concern for many people in the United States when you start talking about universal health care. But the doctors are private, the hospitals are private. They're mostly reimbursed through the big three. There's like three big insurance companies that cover most of the citizens of France. And France's system is actually kind of touted as one of the healthiest and one of the systems that has the best health outcomes. So that's great. It is, however, one of the higher cost ones. It takes roughly about, oh God, what did it say? I think it was 18% of, oh no, it was 14% of the GDP of France. So that's on the high end. On the other side, you have the UK, and we're going to be looking at Norway, and they take about 10 or 11% of the GDP. So going and moving on to Norway, they have what we commonly refer to and think of when we think universal health care. Most of the hospitals are run by the state. Most of the doctors are employees of the state. Patients pay out of pocket up to a regulated amount. And once they hit that amount, and it's roughly $500 to $700 in US dollars a year, everything after that is free. Free. They don't have to pay out of pocket. They are paid through payroll taxes. It is a progressive tax, which means that people who make less money pay less. People who make more money pay more. But again, that's capped out. So why isn't the U.S. healthcare system working? Of your gross First of all, we talked about how France's healthcare system was very costly at, I think it was just under 14% of the GDP. By comparison, the US is at 17.9% of GDP, and it is growing exponentially. So we are the costliest, even though most of our citizens don't have access to. And this is true, even for middle class families. A lot of times they purchase policies that, the deductible is, I've heard of one person, a deductible of $25,000 per year. So why are they even paying premiums? For God's sakes, it's the only time it's going to really come in handy is, God forbid, if they ever get cancer or another really debilitating disease. Another problem why it's not working. Prior to the ACA, there were 45 million American citizens who did not have any access to or any coverage of health insurance. And so that was huge. That was over 10% of the population in the United States. Now, it did drop by 20 million. But we still have 24 million American citizens who are not covered by health insurance, and they have to deal with costs as they arise. The cost to productivity for someone who is ill and going back into that functionalism mindset Sick people, sick workers cost the U.S. economy $530 billion per year. That's huge. Okay, and that's why we want to try to do more preventative and keep people from getting sick. A lack of prevention, in as far as a lot of times some tests are covered, some tests aren't. So if you get a mammogram as a woman and it comes back with something that's there's something on there that looks concerning, but they're not sure what it was. So they order an ultrasound, which is usually a relatively inexpensive procedure. And that ultrasound is not covered. The mammogram is because of the ACA, but the ultrasound to verify is not. So if it's cancer, you're going to have to pay out of pocket to find out whether it's cancerous or whether it's not. And also, it is class based. And again, I know I brought up the middle, going from the middle class on down, that the deductibles, the high deductibles, are becoming prohibitive of them seeking health care, even though they have insurance. When you watch Sicko, you will see that, except for the first 5 minutes of the documentary, the majority of the film is about people who have health care. They have health insurance, and yet they still are not getting the care that they need. And then, of course, we have the pharmaceutical increases. Big Pharma has gone out of its way to kind of put profits first and people last. Costs have often increased 500%. Martin Shkreli, who was a pharma dude, or I think was what his name was, and he was the one who increased the cost of the EpiPen by 500%. Not because costs increased to produce it, but because he simply could charge that much for a life-saving device. So here are those other issues we were going to talk about in U.S. healthcare. Yes, lack of access to care and rising costs are extremely wearing on the U.S. healthcare system. However, there are some other things that need to be addressed. So pandemics. If you recall, we had the Ebola scare several years back. And that, of course, we don't have Ebola native to the United States. So people traveling from areas that did have Ebola, predominantly West Africa. Somebody came here, they had been infected, didn't know it, went to the hospital because they were running a fever, and infected some healthcare providers, the nursing staff, I think, and one of the nurses ended up getting it. So this is spread. When we get a pandemic, it will be extremely costly for all countries to address this and try to prevent it from getting widespread enough where large portions of their population die. The flu is actually much more worrisome than is Ebola. Ebola is spread only through direct contact of body fluids, where the flu is airborne. Somebody sneezes in a room you're in, or sneezes and touches their nose and then touches a doorknob, and 20 minutes later you come and touch a doorknob to open it, you've been exposed to the flu. So those are much more worrisome and, again, very costly. The negative effects of stress, which is high in almost everyone's life in the United States of America. What that does, when you watch the film Stress, Portrait of a Killer, you'll see that stress actually has enormous negative effects on the human body. And conquering that will bring down healthcare costs immensely, blood pressure, obesity, etc. Processed foods. You'll be reading an article about how the sugar industry was able to push the blame away from themselves and onto fats as causes for obesity, high blood pressure, and other growing endemic diseases within the United States population. And you'll see that lobbying has its effects in all aspects. And processed foods, processed sugars are much more harmful to you than we had been originally led to believe. Vaccinations. Anti-vaxxers, people who want to vaccinate but are still concerned about the number of diseases that are covered by a single vaccine, and then people who just straight out feel that we should all vaccinate to protect each other. So while there is no evidence at all, the one research paper that was published in a medical journal that associated vaccinations with autism has since been retracted because the researcher manipulated data to support the theses of connection to autism. He lost his medical license, so that's done with. Now, there was a problem with thimerosal in causing some issues with children. Thimerosal is a preservative that is used in or was used in vaccines, because vaccines are a biological entity and they can spoil. And that has now been removed from vaccinations, and so that has become somewhat safer. But there's other preservative that they put in there that could be potentially harmful. The fact that we're increasing the number of diseases that are in each vaccine, especially in children who are the predominant um, patients that receive this vaccinations and the vaccination schedule, toddlers and infants. And so this is alarming to some parents. They want to vaccinate their children, but they want to slow down how many different diseases are covered under a single vaccination. So, and stretch it out. If they have to go back to the doctor more times, they're fine with that. But they would like to, they're worried and concerned about immune storms or autoimmune diseases. And, I want to see some data on that. And I'm sure they do too. The right to die. There are some states in the United States that allow people to have physician assisted suicide. And there's also refusal of care. You don't want to have life saving efforts. Now, some of them can be, people who don't want to have life saving if they're already really ill and they stop breathing. But some are just refusing to take the treatment itself. And that one is much more common. It's much harder for the state to argue that they need to force you to take that kind of care. Abortion is a health issue. Why? Because even if abortion is outlawed, there will still be abortions taking place. They will just be illegal abortions in most often unclean and unlicensed facilities that will be concerning for both the mother and the potential fetus as well. Botched abortions, backroom abortions, back alley abortions, and the end result with abortions is also that there will always be abortions, and the people who will have the least access to them will be people who are middle class and lower, because rich people will just simply fly their mistresses or their daughters out of the country to receive safe and medically monitored abortions. And then you have the affirmation and rare diseases. So the affirmation comes into play when diseases are not given any legitimization. One example is chronic fatigue syndrome, which more people are afflicted with that in the United States than are high blood pressure, diabetes, and cancer combined. Why has it not been given? It was kind of thought of as a mental disease because predominantly women were the ones afflicted with this. And now there's actual biological evidence that there's a spectrum for this particular disorder, and it usually follows a viral infection of some kind. Most often and most commonly would be the Epstein-Barr, which is mononucleosis. But again, a lot of illnesses get ignored because there's gender discrimination and women are looked at as hysterical anyhow. Obviously we are. So therefore that it becomes problematic. And also rare diseases. So there's a really good movie if you ever want to watch it called Lorenzo's Oil with Nick Nolte and Susan Sarandon. It's from the 90s. But it's a true story of one family's their child, their only child, comes down with what's referred to as shaken puppy syndrome. It's a neurological disorder that usually finds children who are diagnosed with it not living till their teens. Now, the couple, because it was such a rare disease, they had to do all their own research, and they literally quit their jobs or took time off from work and studied and studied and researched, and they found something that's not a cure, but it can stop the progression of the disease. They extended the life of their son. He died when he was, I think, 29 or 30. So he outlived the what his life expectation was by quite significantly. But it's not a cure. So if it's something, you have to take it until until you die, the medication. Otherwise, the disease will begin progressing as it normally would. So, in conclusion, if you can look at the U.S. healthcare system or lack thereof through the big three theories, you can find that there are reasons that each one of them have, and they actually mesh really well together. if you use them together. Yes, we need to have healthy citizens to keep production levels up. Even in a hunter-gatherer society, people have to be healthy enough to perform the roles that they play in society to keep society sustainable. Conflict theory, yes, there are inequalities in our healthcare system, and that causes a dysfunction because then you have higher numbers of workers and who are not healthy. You can see this. There was actually a report talking about how in the US there are more sick people go to work, therefore infecting the entire workforce. And we have these little mini pandemics in the office because people go to work sick. That's a cultural thing going into symbolic interactionism. One, from conflict theory, they can't afford to take a day off work if they don't have sick time because their employer doesn't provide that. And then symbolic interactionism from a very early age. We are taught you keep pushing through that illness. Think of when you went to school and how rough it was, how your parents or your teachers got upset with you if you wanted to take a day off because you were sick. And you were told just tough it up, go in there. Because it does get counted against you, right? They keep track of your sick days and it can cause problems anyhow. So we get that from a very early age. We're socialized into believing that illness is not something you should just take care of. You push through it. And that's not always the healthiest approach to it. So using all these three perspectives, we can really get a better glimpse of how sociology views healthcare and how healthcare is important to the health of a society. Here are your references. I did provide some links if you'd like to go ahead and look at them. And of course, I used your OpenStax textbook as well.